Over the last number of years, it's been very obvious that the world is heading towards more of an ambulatory focus. We need to decentralize care away from the hospital and out of the hospital. Orthopedics, rehab, outpatient surgery are clearly areas that are defined by that sort of model. And to have an opportunity to create a structure and programs proximate to the hospital campus, however not in the hospital, was the ideal way to manage that goal and those efforts.
Our therapy services is one of the fastest growing programs that we've got, and it was pretty clear as we crafted the One Vision campaign that this was going to be an important component to developing our ambulatory services and outpatient therapies to give better space and better capabilities, offer even more diverse services, and our space was just incredibly constrained where we were. So getting this new outpatient rehabilitation center in play has been incredibly important for us.
The care that you receive is from the therapist. You stay with the therapist from start to finish. You meet with the same therapist every visit, so they're able to develop a relationship with you and able to progress your program in an appropriate, individualized manner.
I think being in this new setting, it's really going to give the staff, the hospital, opportunity to grow, opportunity to really shine and show what we're capable of. Gives us still that Doylestown hospital setting, but still able to let us kind of stand out on our own for what we can do for the community and what we have to offer for everybody.
Doylestown Hospital has been a great place to work, and I've stayed here for so many years because I feel like the work that I do here has an impact and makes a difference on people's lives. And I think until you've had an injury to your hand or arm, people don't realize how that affects not just what they can do physically, but how people feel about themselves as a person and the different roles that they have in their life, and how if you lose some of your independence, how much that can affect somebody. So I've always felt that I play a small role in helping somebody gain back their independence.
We really strive to have the patient stay with the same therapist throughout their course of care, which really allows continuity of care. It allows the patient and the therapist to gain a rapport, which makes the patients more comfortable. And we also utilize all licensed therapists, so we don't use assistants or anything, which really gives the best quality of care for the patients.
The benefit to the community that I see this building will bring is that they're seeing now the hospital on many levels has already put so much into them, but now it's also being carried through for their rehab. You know, sometimes when someone has shoulder pain or back pain or pelvic floor issues, you're looking at that and yes, it doesn't have this dire need to it the same way emergency care would, but it's important to people because it's their function. It's their ability to pick up their grandchild or run and play soccer with their child or go to work and sit at their desk and not have back pain. So when patients walk in and they see this outstanding facility and then they have a therapist whose skill set matches that, I'm hoping it will bring people more comfort to know everyone's invested in their best interest and outcome that's wonderful for them, and everyone's drive is matching where they're at getting their care.
Through that process, you take a lot of pride and joy, and you encourage the patient during that whole transition through the early stages of their recovery and getting them back to their hopefully their normal previous level of function that they were at. You know, it's just great when we can get them back to doing their usual daily life and activities without restrictions, without pain. You know.
It definitely gives us room to expand. Before we had more limited office space, so if we wanted to see more patients or if we wanted to kind of have more equipment or things like that, we didn't really have the space to accommodate it. So it definitely will allow us to, again, have more availability to treat patients and then more room to grow our programs and, yeah, more just opportunities for us.
Well, I think what we've been able to do now is to marry the professional and competency of physical therapist with an outstanding new facility that's bright, has new equipment, is large enough to be able to accomplish the mission, and to be able to communicate to the Doylestown community that we have an outstanding outpatient rehabilitation center here at Doylestown Hospital.